Episode 30C. Mary and Iowa and North Carolina. Mary noted that an article is about open wood burning being banned, so this is not an article about residential indoor wood burning. Mary noted in Iowa, the city of Fairbank brush site at the end of Grove Street is too close to town to have open burning there. The Iowa Department of Natural Resources wrote to the mayor pro tem of Fairbank in an August 8 cease and desist letter. Mary noted that the PM 2.5 exposure, which is shown to cause harm in a statistical study of hemodialysis patients, is just above what the EPA may lower its standard to after November 2022, 8 micrograms per meter cubed, to be closer to the World Health Organization standard of 5 micrograms per meter cubed. Mary noted that a National Kidney Foundation study concluded that long-term ambient PM 2.5 exposure was associated with cardiovascular disease, CVD, outcomes among patients receiving maintenance in-center hemodialysis, HD. Stronger associations between long-term PM 2.5 exposure and adverse effects were observed among patients who were of advanced age, had chronic obstructive pulmonary disease, COPD, or were Asian. Exposure to particulate matter, with a diameter of 2.5 microns, PM 2.5, has been linked to chronic kidney disease, hospitalization, poor transplantation outcomes, and early death. Recent research finds that these air pollutants increase the risk for both fatal and non-fatal cardiovascular events in patients receiving hemodialysis. Using 2011 to 2016 data from the U.S. Renal Data System, investigators identified 314,079 patients receiving in-center hemodialysis, 51% aged 65 years or older. They calculated PM 2.5 exposure using the zip code of the dialysis clinic attended by each patient. The median annual PM 2.5 exposure was 8.7 micrograms per cubic meter. Each 1 microgram per cubic meter increment in annual PM 2.5 exposure was significantly associated with a 2% increased risk for cardiovascular events and a 2% increased risk for death from cardiovascular causes, Anna G. Rappold, Ph.D., of the U.S. Environmental Protection Agency in Research Triangle Park, North Carolina, and colleagues reported in the American Journal of Kidney Diseases. Our findings add to the emerging evidence regarding the association between PM 2.5 exposure and outcomes among hemodialysis patients and are consistent with previous results in this population, the authors wrote. A 2021 study published in the American Journal of Nephrology also found that older patients on dialysis who lived in areas with high PM 2.5 had higher mortality risk.